So I do want to let people know that we will be broadcasting live to Facebook. So if you're not comfortable having your video turned on, you can turn it off now. I see a few old friends on here. Flo, hi Flo. Okay. So let's get started. Hi everyone, welcome to our program, Telehealth and Breast Cancer. My name is Christine Benjamin, and I'm the Senior Director of Patient Services and Education at SHARE. For information about all the support services and educational programs SHARE offers, please visit our website at sharecancersupport.org. So tonight we're joined by Dr. Lisa Newman and Arlene Bullard and possibly Andrea Stewart. So after my introduction of our guests, I'll ask questions that have been previously submitted. If you would like to ask a question, please type them into the chat or post them live on Facebook. The program is being recorded and will be available to view at a later time. So I'd like to introduce Dr. Lisa Newman. Dr. Newman is a surgical oncologist and chief of the section of breast surgery at Weill Cornell Medicine and New York-Presbyterian Weill Cornell Medical Center with a clinical and research practice dedicated to breast cancer management. Dr. Newman leads a multidisciplinary breast oncology program that uses state-of-the-art screening and imaging technologies, innovative surgical and reconstruction techniques, and radiation therapies to provide patients with comprehensive breast cancer care. Dr. Newman's primary research focuses on ethnicity-related variation in breast cancer risk and outcome, the evaluation and management of high-risk patients, broadened applications for neoadjuvant chemotherapy, and special surgical techniques. Dr. Newman is also the founding medical director of the International Center for the Study of Breast Cancer Subtypes, which investigates triple-negative breast cancer in women with African ancestry. Arlene Bullard lives and works in Manhattan and is a lifelong resident of the city. By choice, she has spent more than half of her professional life working for not-for-profit institutions. And Arlene's participating today as a patient of Dr. Newman's. And is Andrea here? I'm not sure if Andrea will be able to join us or not, but if she does, Andrea has worked with Dr. Newman for the last 2 years as her surgical coordinator. She ensures patients have the required imaging, scans, and authorization prior to surgery, then schedules surgery and communicates regularly with patients before and after surgery to answer questions, calm fears, and schedule physical examinations or telehealth appointments. So welcome to all of our guests. Thank you so much for joining us today. We really appreciate you being here. I have a first question for Dr. Newman. So Dr. Newman, why don't you tell us a little bit about your use of telehealth in your practice?
Well, you know, it's kind of interesting. The whole concept of telehealth and video visits is a technology that had been supported and promoted by several individuals in the healthcare system, both here at Weill Cornell and in other institutions. But we had always thought that for the breast clinics, it wasn't going to have much utility because the whole breast exam, evaluation of breast problems is such an, you know, a very personal type of a situation. It didn't seem that telehealth was really going to fit into what we do in breast clinics. But alas, COVID hit, and you know, with the heartbreak of the New York City shutdown in March, we really didn't have much of a choice. We had to all become accustomed to things that were outside of our normal realm of clinical activities. We had to adapt basically and figure out some way that we could continue to provide breast care while keeping people safe. And with the the New York City shutdown, we literally had to shut down our the bulk of our outpatient clinical practices so that all of the resources in the healthcare system could be diverted towards COVID care. And we had to support social distancing so that people could basically stay off the streets as much as possible and stay out of the clinics, out of the hospitals. So we had to, again, adapt, and telehealth provided us with a very valuable opportunity to do so successfully for our breast patients. And so we were very proud to be able to adopt this technology very nimbly and to embrace it wholeheartedly so that we could stay connected with our patients and develop new connections with the patients that were just receiving a diagnosis of breast cancer. So it's not ideal. I do miss face-to-face interactions with my patients as often as possible, but it provided us with an opportunity to stay connected and continue care for our patients. It also provided wonderful opportunities for us to continue professional communications with our colleagues. In the breast cancer world, delivery of multidisciplinary care, which means that the multiple different specialists representing different types of care really need to work together in some form of face-to-face discussion to discuss all of our patients and make sure that we are providing all of the appropriate treatment plans to all of our patients. So this means having the breast pathologist with the breast radiologist, we're interacting with the breast surgeons, the breast radiation doctors, the breast medical oncologists. We really have a very strong need to be communicating with each other in real time. And part of telehealth is allowing us to use the Zoom technology so that all of the doctors on the team can continue to review all of the patient's care for every new patient and make sure that we are evaluating everything comprehensively and delivering all the appropriate treatment options. So it has been a godsend to us in getting through the pandemic, and we're learning how to incorporate it into best practices moving forward now that we are past the shutdown.
Thank you for that. And I'm going to ask you about conducting actual exams in a moment, but first we want to hear from Arlene. So Arlene, thank you for being here with us. We really appreciate it. And why don't you tell us a little bit about your experience with telehealth?
It's been a very positive one, actually multiple telehealth visits. To start with, a couple of other physicians, but my most regular experience has been with Dr. Newman, the breast cancer team, the medical oncologist, the radiologic oncologist, and it has always been the same kind of the substance of a regular doctor-patient relationship. Of course, it's different. The nature is different. You're not in the same office space. But I have always had the sense in each and every appointment that the doctor has been, Dr. Newman, her colleagues have been focused on me, and that I've had their full attention. So it's a very good experience.
Good. Well, I'm sure we're glad to hear that. I'm sure Dr. Newman's happy to hear that.
Yeah, very, because it does make you feel a little self-conscious. You feel that, potential alienation from the patient just because of the distance, but it's wonderful to feel that patients do understand that, we want our concern to resonate and to get through. Again, not face-to-face, there's nothing like it, but we have to adapt and take advantage of the technologies that are available to continue taking care of each other.
Right.
What a role model in terms of embracing this technology and making sure that it works and making sure that she gets all of the information that she needs. Arlene, I congratulate you. You've always been just phenomenal with in making sure that you utilize it optimally.
Thank you.
So I see that Andrea joined us. Andrea?
Hi, Andrea.
Hi, Andrea.
Maybe we're having some technical difficulties, which is exactly what I was going to ask her about.
Yeah.
So maybe she left and is coming back. So in the meantime, so Dr. Newman, could you tell us about how you might conduct an examination through telehealth?
Yeah. So it's certainly not ideally suited for evaluation of definite clinical findings. If a woman has some changes in the skin of her breast, that we can evaluate. We always make sure that we are in a personal, private environment when we conduct the visits. We certainly make sure that the patients are in their comfort zone, an area where they feel comfortable having the conversation and exposing themselves if that part of the exam is necessary. And so for skin changes, it will work. For evaluating incisions after surgery, the telemedicine visit will work. There is a rate limiting factor, however, and if you do need to analyze a new lump in the breast or another type of a problem in the breast, such as adenopathy, which refers to glands or lymph nodes that are enlarged in the underarm area, that is definitely going to be more challenging with telehealth. A nipple discharge, that's something that we can potentially evaluate through telemedicine. So many aspects of the exam are appropriate for telehealth, but it certainly is not ideal for all aspects. For many situations, however, an advantage to telehealth is the ability of the patient to involve more members of the support network into the conversation. The coming to the clinic with several members of your support staff may not necessarily work out, but a patient may be perfectly comfortable having not only her husband, but maybe her best friend or a couple of her, nearest and dearest with her during that visit. And if she's doing it in comfort of her own home, it's a little bit easier to bring people together.
That's a really good point, especially with COVID-19, when they were really limiting the amount of guests, right, or friends and family that you could bring in with you to an appointment. So that's a really good point. So I think that Andrea is back with us. Andrea?
Andrea, I think you're muted.
I can unmute you.
Okay.
Yes, can you hear me?
I do hear you now.
Okay,
Thanks,
sorry.
Andrea. No worries.
Hi, good evening all.
Hi, Andrea. Thank you for joining us. And I was just getting ready to ask you a question before about maybe some connectivity issues that people might have during a telehealth session, and how you might help people with that technology. And then we lost you from the meeting, and so but we knew that you could fix it and that you'd be back. So maybe you could tell us about that a little bit.
Yeah, so as you can see, there is a lot of technical issues that do happen or does occur actually moments right before patients are ready to log on to their meetings with the physicians itself. So what happens usually, we have patients call us directly so that we can walk them through the entire process all over again. Like we sometimes may have to check them in manually ourselves, or maybe change the visit just so that the provider can see them, or that they can see or be able to be connected to the appointment. Or in worst case scenarios, we have to just send them over to an IT. Sometimes it's just a technical issue that we are unable to assist with. Or sometimes we just have the providers just do a video visit appointment with the patient. So just so that they're able to just see the patient, making sure that they're okay.
Mm-hmm. Mm-hmm. And Andrea has always been phenomenal, right there with us in clinic physically. And when it doesn't work, she always figures out another alternative. So if it means having a telephone call or, working out some alternate plan, somehow she always makes it happen. So we really have support staff, preferably a millennial who knows how to manipulate all of these things. So Andrea, I can't thank you enough.
Thank you. Yeah, there's no like straightforward answer to it. Sometimes just the system is just down and we have no idea what's going on within the moment. Could be just like a glitch in the system where we have to just like come up with a game plan like right away.
Right. And someone who's participating in the meeting right now is asking, are they usually video calls? Or, so I hear that you're saying sometimes if there's an issue with video, you might just switch over to a telephone call.
Mm-hmm.
And then what about people that, have connectivity issues or live in a rural area where internet is not as robust, perhaps? How do you
Yeah,
do
so we basically see whatever it's accommodating for the patient and the provider. So as of right now, we are noticing that a lot of providers are now accepting patients to come into the office. So if video visits is not something that patients are comfortable with doing or they do not have a smartphone, we do encourage patients to come into the office to meet up with the providers to go over their care.
Great.
And just the opportunity to set up the video visit often solidifies the connection between the patient and the provider, because at least you've made the attempt, and as you work through the process of figuring out plan B or a plan C, you're still maintaining that connection. And sometimes that just, leads to being creative and making it work. Like if we've had to go to a telephone conversation because the video visit didn't seem to work, sometimes I'll just FaceTime with the patient, or we'll just go through whatever we need to go through as a telephone conversation. I've had times when this is an example of how video visits have actually enhanced the whole clinic experience. There are times when the clinic schedule is running way behind. Sorry, Andrea knows that's actually behind in clinic. And so the patients that are scheduled for the video visits, we can just shoot them a quick text message and let them know that the timeline is not what we expected it to be, and the patients can go about their business. I've sometimes converted a video visit to a conversation with a patient when they're out having lunch or shopping or doing something else. We can, you do have more flexibility.
Right.
I'm glad you mentioned the issue of rural issues, and the digital divide actually isn't only a rural versus urban issue. It really is heartbreaking that even within cities, you can have huge differences in access to best quality internet and broadband access. And in my opinion, internet should be just like electricity and clean running water. Everybody should have access to it. So in my opinion, we really do need some type of a governmental legislative mandate to improve equitable access to high quality internet access.
Especially now.
Yes, especially now.
Especially now. So Arlene, at what point during your diagnosis or treatment did you enter into the use of telehealth?
Well, it was really right away, because my diagnosis was so many months ago, Christine, that the pandemic had already begun to shut down all the offices when I first spoke to Andrea. So the only alternative was to have my initial appointment with Dr. Newman be through telehealth. So that was how I first met Dr. Newman.
So you were diagnosed, you were discussing treatment options, surgery being one of them, and your first ever appointment with your breast surgeon was through telehealth.
Yes, yes, quite surprising. It seemed quite unlikely to me also. I don't know how this is going to work. But
were you nervous about that? Did you have concerns that maybe she wouldn't be able to?
Absolutely, absolutely, Christine, because this, as Dr. Newman articulated, of course, there's no substitute for hands-on. And here are these educated, these trained, experienced hands that can touch and know how it feels and how a breast should feel. And I'm thinking, how can this possibly work? But Andrea was saying, it's going to work. You need to get in there. But I said, okay, I have to have this appointment. I certainly can't delay it. Who knew how long the pandemic would go on? And that proved to be the most advantageous thing, to just have this initial appointment. But my concerns were allayed because Dr. Newman, through her expertise, guided me and asked me particular questions that really, no substitute for hands-on and touching me, but could elicit my responses that would say, well, it feels this way, it looks this way. And as you can perhaps tell, I like language, so there I was trying to be as descriptive as possible anyway. So then that just calmed me, and I said, okay, I'm in good hands with this. This just might work. Yeah,
And someone is writing into the chat here sort of a sequel to your question. So Dr. Newman, what helps you to understand if a patient is experiencing, pain, for example, that the person's writing in continues to have pain and it's not been able to be resolved? And so how during a telehealth session might you be able to help someone like that if you can't physically touch or examine in that way?
Yeah, so that is a great question, and you're correct, and that is a limitation. We will ask for patients to work with us as much as possible and through their own self-touch to be able to point out specific spots that are particularly tender, and then we will try to correlate the areas that they are pointing to with any changes in the skin that are concerning. And then we can schedule any imaging that's necessary to further evaluate that area. So for example, with the breast, if we are concerned that an area of tenderness might represent an area of infection or an abscess in the breast, being able to work with the patient to identify the specific site might help us to better schedule a targeted ultrasound to evaluate that area of possible infection in the breast. So we really just have to do the best we can. It's definitely not ideal. The ideal would be to not have this pandemic going on at all, and to be able to go back to resuming our usual clinic practices, but we can't let the pandemic completely paralyze us in terms of delivering healthcare. So we just work with the best we can. And speaking of the pandemic, one thing that I do enjoy about the meetings and the video visits is that at least we can see the faces of our patients. We're not all covered up with the masks as we have to be in the clinics today. So it is nice to see a smiling face. And if the face has a lot of concern and anxiety on it, which is understandable, we're dealing with that as well a lot in this field, at least we can see the full facial expression through video visits. So that's one advantage of the pandemic atmosphere and conducting video visits as opposed to the clinic visits.
Yeah, that's a good point. So I know, Andrea, I think there's a question for you. People have been asking about whether or not telemedicine visits are covered by insurance, private insurance, Medicaid, or Medicare.
So from what we're being told, televisits are covered by their insurance. It's just covering as a regular office visit. So I don't think there's a surcharge for their co-payments on televisits. I think that's part of there's an exception towards that, but from what we're finding out, that it is covered by all insurances.
That's good to know. And this is either to Andrea or to Dr. Newman. I read an article recently about some confidentiality breaches that may occur with telehealth, telemedicine? Are your patients concerned about somehow their information getting out or being, Zoom bombed during a visit, during a checkup? Are those issues? Sorry about that. Maybe that was a Zoom bomb. I'm not sure.
Yeah, right.
So what about confidentiality, HIPAA compliancy? You don't use Zoom, right? You use a special.
Right.
Okay.
Yeah.
You want to
Yeah,
talk?
it's a hospital-based system. The Zoom meetings are password protected, but those are not for patient interactions. The Zoom meetings are for our tumor board conferences when we are interacting with other healthcare professionals. But even those do have to be set up through the institution and password protected so that you know who's there.
And are patients concerned about that? Has patients ever bring that up to you?
I haven't had any experience with patients being concerned with their with HIPAA being violated, moving forward to having a televisit. So I think a lot of the patients that we're seeing are very comfortable with moving forward with doing televisits. They're actually more accepting of doing televisits versus coming into the actual visit, the office itself directly.
That is a great question, but I have to emphasize what Andrea said. To me personally, I haven't had any patients voice a concern about that, which is actually surprising because it's a very, very valid question to ask. And thus far, I haven't had any experiences with adverse issues with confidentiality or privacy breaches.
Good. That's great. That's good to know. So, Arlene, what advice do you have for other patients to help them maximize their telehealth visits?
Well, I guess I would say to start with to think in the way that you would if it was an in-person visit. I mean, it's no substitute. We all know that. But to be as prepared as you can to describe, not to be limited by the fact that it is in this regard, that it is a telehealth appointment, to go ahead and say, I'm going to describe exactly how I'm feeling. Let the doctor know exactly what's going on. And I use the word description to be as descriptive as possible. Symptoms is how I'm feeling so that the doctor can have this fuller picture in the absence of you being in front of the doctor to say that. And as I always do with in-person appointments and have done in these months with telehealth appointments, to write down every single question. But also don't say, all right, maybe I'll edit myself and I'm going to wait until I do get to an in-person appointment because you don't know what's going on. You have to speak to your doctor and help them understand and diagnose and treat you. So take full advantage of it. And I'll tell you very quickly something I did with the radiologic oncologist with my fears about radiation and uncertainty. You know, we hear so much that's certainly not, we hear all the hard stuff about radiation. A friend was with me on another device who was out of town, who's a friend I've had for most of my life, who's a nurse midwife, and thought of questions. So that has come up already. You've mentioned that, Dr. Du, about bringing people, and I certainly second that. That was my own experience. That helped me so much. I mean, Dr. Eng was wonderful, but also having a friend who knew me and could hear the questions and say, okay, well, what about this too on my behalf? So I guess if somebody said, Arlene, sum it up, say, nothing like an in-person visit, but prepare as if you were going to be making an in-person visit and seeing your doctor in the office. Don't give yourself any short shrift there. Just prepare as you would normally.
So I think that's good advice, and it was really brilliant of you to pull in a friend with possibly some knowledge who doesn't assumably live near you, but who can offer some assistance and support and ask some questions that you may not have thought about at the time. That was a pretty brilliant thing to do on your part.
Thank you. Thank you. And she did think of the
Yeah.
question.
Mm-hmm.
That so helped me. And I exhaled deeply at the end of the appointment, because did you hear that, Arlene? Did you get it? Yes, I did.
Yeah,
So
it's
it
so
was,
easy to have an out-of-body experience
oh my gosh.
and a medical interaction. So it's nice to have some company to stay grounded. But Arlene does practice what she preaches. She was always very, very prepared for every visit, and is ready to have that conversation knowledgeably and make it all meaningful. You made every
Yes.
count.
It sounds like, Arlene, that you also had to utilize some other skills as well, right? Really trying to explain what you were feeling and the location of it, and you were talking about it before. So,
That's interesting. Yes, yeah, you're right about that, because I have become even more aware of that, of saying, all right, these moments are so precious. They are in person too, of course, but I'm sure the diagnosis pushed me even more so. I've got to tell Dr. Newman, this is serious, Arlene. You've got to really be able to tell her. So there I was thinking about it and writing things down and saying, you've got to be able to describe to her exactly how you're feeling, and wanting to do that and provide as much. Perhaps I guess it's the diagnosis not being a telehealth appointment, but the diagnosis saying to me even more so, be able to articulate this, be able to tell, so that Dr. Newman can be informed. So yes, Christine, I did have to really polish up those skills. This is what's going on.
right, yeah, it sounds like you did a great job.
Yeah, you nailed it, Nolan.
So someone is asking, so how does a phone call or a telehealth video visit, how does that get charted into the patient's record? Do you take notes during the call, Dr. Newman, or do you have the visit and do the exam and then take notes after into the record, or how does that work?
So me personally, I've never really mastered the art of being able to enter notes into the computer while I'm having the interaction with the patient, regardless of whether it's an in-clinic visit or a telehealth visit. I always go through everything and then do my charting afterwards. I'm just not able to multitask and do both at the same time. I have the conversations, the interactions, whatever I'm doing with the patient. That for me is always totally separate from anything on the computer, unless I'm trying to show the patient her mammogram or some ultrasound finding, if there's something I'm trying to demonstrate on the computer. So that part for me is always the same. I have that interaction with the patient in whatever format it is it's going to be in, and then my computer documentation, medical record charting is always done afterwards.
I'm sure patients really appreciate that.
It's the only way I know how to do it, and I'm too old to change now.
I'm not sure about that, but I'm sure that patients, feel like they're getting your undivided attention, right? Sometimes patients feel that.
I hope so.
Yeah. So I want to encourage people to go ahead and put some more questions into the chat. But Dr. Newman, here's one for you. That was my dog sneezing. Can you talk a little bit about how telemedicine might help with health disparities or contribute to health disparities? Can you talk about that a little bit?
Sure. So I think that there are some potentials for telehealth to address disparities, because one of the reasons for disparities in public health are related to the socioeconomics of many of our communities of color, particular African Americans and Hispanic Latino Americans, having barriers to accessing the healthcare system because of certainly issues with higher rates of poverty in those communities versus the white American community, higher rates of lacking insurance or being underinsured. And those are definitely huge issues that we really need to address and correct. But sometimes disparities are related to the logistics of difficulties in being able to navigate the healthcare system and to get the healthcare appointments to fit into your professional schedule. Often communities of color are going to be overrepresented among jobs where you can't easily get a day off to go to the hospital for a visit, or time off to participate in a video visit, or you can't arrange for childcare easily so that you can get the mammogram or whatever it is that you need to take care of your own healthcare needs. So there is the potential for telehealth and video visits to mitigate some of those logistic issues. It's not perfect, but at least there is the potential for telehealth to be more easily incorporated into personal and professional responsibilities. So I'm hopeful that we can make it work. However, there is that issue that we were talking about before with broadband internet access not being equitably available and accessible across all communities, and that it is a huge disparity. According to the US Census, about a third of African American households do not have a subscription to a broadband internet access, and that's compared to about 1/5 of white American households lacking a subscription for internet broadband access. And we rely upon internet technology for so much of day-to-day life, not just telehealth, where it's taken in a very important role in the pandemic experience, but in terms of getting information regarding healthcare, in terms of looking for jobs even. It's just a huge component of 21st century American life. And if you don't have optimal access, it's a huge disservice in so many ways. So there's the potential for telehealth to improve things, but because of the digital divide, there's also the very real risk that it might exacerbate disparities as well.
Mm-hmm. Do you think it's here to stay?
I do. Yes. I am convinced it's here to stay. And I think that's a safe assumption to make because, again, in breast in particular, we always assumed that telehealth would have no role in what we do. But when we were forced to integrate it into our practices, it very clearly became something that we're going to rely upon and will be relying upon indefinitely.
So is telehealth being utilized in clinical trials, for example? So instead of having, in-person visits for people that are participating in clinical trials, is telehealth being used under those circumstances?
Now that's a great question, and I think that we probably have a long way to go in terms of optimizing integration of telehealth into clinical trials participation, which means we are going to need to implement clinical trials to look at telehealth and how it works in that setting. Now, I don't know the extent to which you can replace an in-person informed consent for a clinical trial, replace that with a telemedicine visit. In our own breast program, we are still relying upon the face-to-face interactions in order to ensure a proper informed consent. But some consent processes can be via an internet-based signing of the form. So as long as there is documentation that there has been the interaction, preferably in person, you can rely upon internet services for the actual final documentation. But that's not going to be the case for all clinical trials for sure. But I do know that for some of them, you can rely upon that signature portion through internet-based communications.
And what about wearable devices, or, your iPhone these days can pretty much give you some information about health, and there are other devices that people can wear that can, through the internet, provide information directly to their medical provider about certain, things that are happening in one's body. Do you utilize any of that, or do you see that becoming a part of sort of this movement?
That sounds like a question from a millennial, and I believe that probably is on the horizon and will become more and more the important aspect of our patient-physician communications. Right now, the extent to which we use it for just random communications really varies. I actually am pretty liberal about sharing my cell phone number with patients. And so I have no problem at all with a patient texting me if they have a question or a concern, as long as the patient is comfortable with using that texting technology. And I'm always very cautious to make sure that I don't leave names attached to any patient telephone numbers if a patient does text me. And the patient will have to understand that they are texting me as an individual, and there are those other outstanding questions, as with any other interaction regarding concerns about privacy. But I obviously do everything possible to make sure that nobody else has access to my cell phone but me. But a patient, if they use my cell phone number to text me, they do have to understand that they're texting my personal cell phone. They're not texting to a telephone number in the hospital or in the clinic. It's my personal phone.
Mm-hmm. And someone from Facebook is asking if you were using telehealth services prior to the pandemic.
I was not. Some clinics were using telehealth services, and there was definitely a promotional effort within many different institutions, and certainly at NYP and Weill Cornell, to try to get telehealth integrated more robustly into several clinics. But breast was slow to come to the table because of the intensity and the nature of the interaction related to breast problem. But when we had to adapt, we did so.
And Arlene, if you were given the option of an in-person visit or a telehealth visit, what would you take?
Oh my goodness, Christine. Well, I'll admit, of course, in person. But telehealth, I know, is not a lesser alternative, particularly, as I said before, when I really have the need to have that doctor-patient visit. So I don't know, they're different.
Yeah.
That's what it makes it such a difficult question. It's not really an easy question. They're very different because at times I think it's just, all right, I'm going to need to have an appointment with Dr. Newman or any other physician, and I might be someplace that's it's inconvenient where I can't get to the doctor's office with ease, and who knows? That's not so. I think it depends. All right, give me a moment. I think it depends on the situation.
Sure.
I'll still say in person is my preferred way of seeing a physician anytime. But I now have confidence in how valuable I can tell you sincerely, confidence in how valuable the telehealth appointments are too. They just continue that conversation. They continue that treatment.
Yeah, it's a nice item. And it's not all bad to be able to sit in the comfort of your own living room with a cup of coffee and in your hand while you're talking to the physician.
And so someone is saying, thank you, Arlene, for your insights, and thank you, Dr. Newman, for your visionary embrace of this new technology. And here's a question for Andrea, perhaps. Is the technology for these visits being updated continuously? Are they making them a little more user-friendly each time? Some people are talking about the fact that, they've had some issues connecting or, didn't understand the platform. What do you think about that, Andrea?
I think the technology is being updated daily. There has been a huge difference between when we first initially started the rollout with the telemedicine to where it is right now. I think it's more user-friendly at this point because a lot of the patients have now gotten the hang of how to navigate through the system. Even when they are facing difficulties, they know exactly who to call from the provider's office or exactly who to call from IT to help them sort out any kind of kinks within the system. I think now there's also another link that takes them from the televisit to like a Zoom style. So people are more familiar with a Zoom style kind of approach than an actual televisit. So they're feeling a little bit more comfortable with using the system now than they were when we first initially started.
Good to know. And Meryl is asking, how long are the visits usually, telehealth visits?
I think it depends on if it's a new visit versus a post-op visit. Just like when you go into your doctor's office, your new consultation is usually a longer visit. So about I would say 30 to 45 minutes, depending on how long the conversation lasts between the patient and the provider. Whereas a post-op visit, even if you were to come into the office, it's relatively short because they're just taking a look at the incision and answering any kind of questions that the patient may have. So usually we book about 15 minutes for those type of visits. And if it's more of a follow-up based kind of conversation or appointments, usually about 20 to 30 minutes.
Dr. Newman,
so it's relatively,
go ahead.
Sorry, I was going to say relatively the same amount of time that the patient would, that we would usually book out if the patient were to come into the actual office.
But it sounds like Dr. Newman probably spends a little more time. She was talking earlier about not always being right on schedule.
I'm always running behind. I know what that laugh means. I'm a bad girl. Always right. But we love what we do. We don't like it. It's bad when we have to give bad news, but there's nothing like our interactions with our patients. It's a very special relationship. So all these interactions deserve time.
Yeah. And although, most people don't like to be kept waiting, they do appreciate the fact that you're spending additional time with someone who probably needs to have more time spent with them. So I think most patients are probably pretty understanding.
Could I ask a question of the attendees? I'm just curious if there are any attendees who have had a bad experience with a telemedicine visit, and I'd like some feedback about how the video visit can be improved if anyone has had a bad experience with it.
So feel free to unmute or type something in the chat. Has anyone who's on the meeting right now has anyone had a telehealth experience?
Oh, I see one. Yeah.
So someone is saying that one visit she could barely hear her doctor, so that was difficult for her. And PT was very difficult. So I guess not getting the hands-on, assistance from a physical therapist. Anyone else?
Yeah, I didn't think about that. Physical therapy, I guess PTOT, aside from showing people exercises, that would be very, very challenging to accommodate appropriately through telehealth.
Someone is saying long waiting times, waiting over 30 minutes to hear from the doctor.
Yeah, that's definitely a struggle in any clinic. But my experience has been that at least with a telehealth visit that's running late, I can communicate with the patients, or Andrea can communicate with the patients on my behalf to let them know that things are running late. And most of the time it's easier for patients to accommodate that delay if they're not sitting in a waiting room with that delay. But nobody likes to be kept waiting. It's just, it's rude. And I apologize profusely for the fact that I am chronically behind schedule. I know that's never a pleasant experience.
Someone is saying Carol saying that they had difficulty getting connected for her husband's telemedicine appointment. My telehealth visit was okay, but I'm supposed to go for tests and I don't feel comfortable doing this going in.
Yeah, so we definitely have some improvements to make with the technology for sure, to make it work well for everyone. It's definitely not perfect. On the other hand, it does start to address the concerns and the reservations that patients have regarding coming into the hospital. So I totally understand those fears. They're legitimate. But here in New York City in particular, I think we should all be quite proud of how we have gotten past the pandemic, and we've kept our COVID positive testing rate very, very low, much lower than most other parts of the country. And the hospital system, certainly here at NYP and Weill Cornell, we have absolutely been successful in making things work so that coming in to get yourself taken care of is safe. We do know how to coordinate the scheduling and to maintain the spacing in the lobby so that we can make sure that you're taken care of safely.
So Carol is saying that her husband's being treated in the VA and they're really wanting to make telehealth work, but they're being challenged by technology. And I imagine it really varies from institution to institution.
Yeah, it does. It does. But I appreciate hearing this feedback because it does it just shows that we still have some work to do to improve these systems.
Yeah, it seems like the technology piece, the connecting piece is what people are concerned about mostly.
Yeah. Another thing that I've noticed through the whole pandemic experience is that there's been such a large number of individuals and families that have just left the city completely. And so we have at least had the benefit of being able to maintain communications with those patients, even, whether if they're in Connecticut, Florida, wherever they've decided to hunker down, we've had the opportunity to continue interacting with them using telehealth.
So now, have you seen new patients from out of town because of telehealth?
Yeah, definitely. Absolutely. Yeah. And we always try to coordinate what the needs are in terms of figuring out when it's the most appropriate time to bring that patient in for a face-to-face visit. And we just started out by the conversation, by reviewing and discussing the breast imaging, any biopsy information. We sort it all out and figure out how far we can go with the telehealth video visits, conversations, and then try to make sure that the in-person visit is set up at the right time so that we can minimize the number of visits that the patient needs to make and can optimally support the social distancing policies.
Mm-hmm. So Arlene, I think this is my last question for you. What for you has been the biggest challenge around telehealth?
Well, it's curiously, not surprisingly, I guess, with the discussion about the issues of technology getting in the way, it's actually been the physical use of the device, of being at home and saying, I'm not going to be distracted. I'm going to carve out this time and this space. This is my medical appointment. I'm not going to. I'm not going to be distracted by being home, but I think may sound silly, but I don't even know what other language to use, but say to make the device my friend in the so it's not in my way. That is, and I thought a lot, Christine, about what was my biggest challenge. Of course, it's number one is saying, get adjusted. This is not in person. This will work. And we know that's number one, but ongoing saying I'm adjusting to it and embracing it as much as possible. But okay, where am I going to put that iPad? I think the last time I had uh, a telehealth appointment with Dr. Newman, I made such a big deal about placing the iPad in such a way. So I said, well, I'm going to do this so that it's at least it's like I'm sitting across the desk and place. It was really fun. I was laughing at myself, but it's
You were fabulous.
but that's been it. Seriously, Christine, that has been it. Saying, all right, you used to just gabbing on the phone or something else. Just make friends with it. This is going to be a vehicle to something good. Have this medical appointment to help you get better. So yeah, it's looking at the device in a different way, I guess.
Right.
Yeah.
And
I've
Andrea,
loved being able to see my patients with their kids popping in the room periodically, or their pets. I get a real kick out of that.
and Carol was saying that, you know, she was able to be with her husband. We talked about this before, Carol, maybe before you joined, that Arlene had a friend of hers that lives somewhere else participate in her meeting. And she was able to ask questions that Arlene didn't think about and was able to make notes for her and get the information that, you know, we all tend to miss during those important meetings that we're nervous about. So Andrea, any advice for people about how to best prepare for a telehealth visit? Is there any way that we can work on the technology beforehand? How should we best prepare?
That's a good question. I would say key just to be patient because it takes a while just to get used to the entire system. If you feel stuck at any point, I would say give us a call because we can really take our time out of our day just to help exactly like pinpoint where you're stuck. And worst case scenario, we can always send you over to an IT person who can really help wean out all the kinks. It's not easy, so I would just say have somebody at least with you the first time to help you while you are setting up a username and a password. If you tend to forget anything like your username and password, there are options for you to change to something a little bit more easier for you one to remember. Mm-hmm. And just remember, you're not the only one who's going through this kind of change, so that we are very patient with you. Just remember that it's going to be okay, and we're always here for you to help you out. Don't forget we're all going through the same thing at the same time.
Yeah. We're all suffering together.
We're all suffering together. So I know exactly what it's like getting the kinks and it's not working. I can help you out. We can always help you out. That's what the main thing is. Just remember that there's always somebody on the other line that can help you out. You can get through it.
That's terrific. Dr. Newman, any last comments?
Yeah, I think the way Andrea said about being patient, we are all trying to work out these kinks together. So we appreciate the fact that we're all learning together, and we'll get through this. And I love the way Arlene put it, thinking of the device as your friend. I have to start thinking about the electronic medical record as my friend. I haven't gotten there yet, but I'm that's going to become my mantra, Arlene.
Any last questions from the audience? Well, I want to thank you, Dr. Newman, Arlene, Andrea. You have all been really terrific. Thank you so much. Thank you for your time. Thank you, everyone who participated. Have a great night, everyone.
Good to see you, Carol.
Thank
And
you.
thanks so much, Christine.
Thanks,
Take
Dr.
care,
Taylor.
Arlene. Talk to you soon.
Thank
Bye,
you.
Arlene.
Thank you.